let's play hardball, which is, what about the normal dog that has an increased ALT? What happens when you do some routine wellness check, and much to everybody's irritation, you got this value that comes back unexpectedly high? Now, if you have a clinically normal dog and the only thing that's abnormal is the ALT, i.e. the albumin is not only normal, but it's like mid-range normal. A comment there I think is in order. You know, sometimes we realize that even though a value is normal, it's not normal enough, right? For example, where I'm at, the serum creatinine normal range is like 0.1 to 2. But everybody realizes that 2, maybe it's the normal range, but it's not normal enough. When a dog has a creatinine of 2, there is kidney disease going on. Well, let's talk about albumin for a second. The normal range where I'm at is 2.5 to 4.7. That being said, if I see 2.6, I don't care if it's in the normal range. It's not normal enough. Same thing with cholesterol. Cholesterol is like 120 to 260. If I have a 122, that's not normal enough. Or bilirubin. Normal bilirubin is less than 0.8. A 0.6 is not normal enough. So if I have a clinically normal dog, and I mean everything is not only normal but real normal, and an increased ALT is the only abnormality, my attitude is like this. If the ALT is less than 3 to 4 times normal, or if it's only transiently increased, it's rarely important. Now, I am not saying that a normal ALT guarantees they have no liver disease. Okay, we're going to deal with that in a minute. But what I'm saying is that if the ALT is less than 3 to 4 times normal, I mean, you can squint your eyes at the dog and get an ALT that high almost. Transient, by transient I mean less than 4 to 6 weeks. If the ALT comes in at 1,000 on Monday, and 2 weeks later I check it and it's gone down to 600, and a week later it's going down to 200 or whatever. I mean, if it goes down, then the dog got exposed to something, fine, it's doing better, okay. If it's less than 3 to 4 times normal or transiently increased, I don't get excited. Now, if it's more than 3 to 4 times normal and it's persistently increased, and persistent means at least 4 and preferably 6 weeks, then I get excited. Now, I'm not guaranteeing that it is important, but I'm saying it's much more likely to be important. And now at this point, we start doing a major workup and we may consider biopsy. Now, some people will say, Willard, give me a break. If I go biopsying dogs just because the ALT is 4 or 5 times normal, I may get a normal biopsy back. You're right. That's the price of doing business. Now, the way I look at it is like this, and I know this is going to sound like I'm a jaded, cynical person. I hope I'm not. Maybe I am. I don't know. But the way I look at it is, if somebody wants a job in which they can be absolutely sure of doing the right thing and never making a mistake, whatever they should do, they should not become a veterinarian. Veterinary medicine is about making decisions in the absence of certainty. Veterinary medicine is about making judgments. My attitude is very simple. If all you needed was a bunch of facts to be a veterinarian, then you're a fool for going to school. You should just buy a copy of Ettinger and Feldman. You got more facts than you'll know how to use in the next 50 years. Veterinary medicine consists of making decisions in the absence of certainty. That's the ball game. That's the playing field. Now, yes, it is absolutely possible that a dog that has an ALT that is 5 or 7 times normal may have absolutely no significant disease. I've seen it many times. But what I'm saying is the risk of having something clinically important starts rising exponentially. Now, let's play games for a second. Let's pretend that you are my patient and I am your physician. And I say, hey, John, hey, Mary, gee, you know, your ALT is 5 or 6 times normal, but you feel pretty good. Tell you what, let's don't worry about it. What would you say? I hope you'd say, excuse me, boss, let's talk about this. Or maybe just fire me and find someone else. Again, the whole point is, if you wait until you're certain the animal has liver disease, many times all you need is a black plastic bag. Not always, but many times. So my attitude is I tell people, look, A, I know your dog has liver disease. Now, I do not know that it's significant. In fact, I hope it isn't significant. But you know what? I know that it might be important. I don't know that it is, but I know it might be. And I know that if it is important, it's better to find out sooner rather than later. And I tell them, now, you know, if we biopsy your dog's liver, I really hope we don't find anything bad. I don't want to find something bad in your liver, but I might find something bad. So you tell me, you know. I mean, I'm just telling you right now, the best thing is to find out, know one way or the other, and get on with life. And I hope we don't find anything bad, but we could. Now, I don't know what it is. It seems to me like veterinarians have this thing, you know. It's like if I take a biopsy and if I don't find some horrible, terrible, fatal disease, oh, I'm so sorry, you know. I wish we would have found something bad. It would make me feel good as a vet. No, that's not the way it works. You know, if I came up to you, if you had a liver biopsy and it was normal, you'd be happy, wouldn't you? I mean, come on, would you come up and start beating on the physician because, hey, you biopsied my liver and it was normal? No, you'd say, thank goodness it was normal. I mean, you know, once again, you'll have to work with this, you know, as you feel best. But all I'm saying is I tell people, look, I don't know for sure that your dog does have bad liver disease, but I know that it could. And if you want to find out, the sooner the better. I wouldn't wait till you have obvious clinical signs. And if we do biopsy, I hope we find nothing. I don't want to find something bad in your dog, but we might. Briefly. Now, in comparison, let's talk about alkaline phosphatase. Now, this is totally different. If the only thing I find is a high alkaline phosphatase, yes, you have to look for Cushing's. Now, by the way, note how the print starts getting small. How do you look for Cushing's? You do history and physical. If there's nothing on history or physical consistent with Cushing's, don't waste your time and money running an adrenal function test. Don't do it. There is no such thing as an asymptomatic Cushingoid. If there's no PUPD, skin disease, potbelly, alopecia, comedones, etc., then that ain't it. Now, there is a small chance it can be a tumor, you know, and you can consider ultrasound. Now, offhand, how frequent are hepatocellular tumors? Well, I'd say they're well below 4 or 5%, probably below 2%. Now, this is going to sound maybe crass, but to be blunt, you tell me, if you were in Las Vegas gambling your money, would you spend $300, $400 on a 5% chance? Now, the answer is some people would, some people wouldn't. So what I would say is, although you can say, yes, we could do an ultrasound looking for a tumor if the only thing we find is a high alk phos, we realize that that is a genuinely long shot, unless we're talking about Scottish Terriers, right? Scottish Terriers have a very high incidence of hepatocellular carcinoma. And a Scottish Terrier with a real high alkaline phosphatase, it would not be at all inappropriate to do an ultrasound sooner rather than later. Most other dogs, I mean, again, you'll have to determine the phraseology you want to use, but my attitude would be, look, you know, could your dog have a tumor? Well, yes, it could, but your dog could have any other number of things. All I'm saying is that, you know, less than 2 to 3% of dogs that just have a high alkaline phosphatase have a hepatic tumor. Now, if 2 to 3% is more than your comfort level will allow, we should do an ultrasound. So you'll have to go from there. Here's another case. Here's a 4-year-old male Cocker Spaniel with a swollen abdomen. Dark yellow urine and depression were first noticed about 2 days ago. And today the dog's obviously got a very swollen abdomen. He's depressed and has ascites. Here's the blood work. Now take a look. What do you think? Oh my goodness. Now this is good. Let's take a look here for a second. This is good. Look at that. Well, we obviously don't have liver disease, right? Well, let's think about that. True, the liver enzymes are normal, but we note that this BUN is high, bilirubin is high. And the fact of the matter is the body does not like a high bilirubin. For the bilirubin to go up, something has to be going on. We also notice that the albumin is a little bit low. These are all concerning things. Now the short version is the dog has this looks like a transudate. The short version is, here's the dog's liver. Obviously this didn't work out very well. Now you have to ask the question, my gosh, how could the dog have this? I mean, look, the dog's only been sick 2 days, right? Wrong. The dog's had clinical signs 2 days. The dog's had liver disease for months and months and months and months and months. And again, and this is just one example. I can show you lots of examples like this of animals that had clinical signs for 2 or 3 or 4 days and had